Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Knee to Know Show, we're going to talk about going home alone after knee replacement surgery. So is it feasible? Is it safe? Is it appropriate? So before I get into this, make sure you click that subscribe button below and turn on the notifications if you're interested in catching regular videos related to knee replacement surgery, recovery, rehab, exercises, frequently asked questions, and everything else. So let's first look at two important studies. So the first study looked at individuals who were discharged to an inpatient facility after knee replacement surgery from the hospital. They were discharged to an inpatient facility and then eventually discharged home and had home-based services. In the other group, the group they compared this to, the individuals were discharged home from the hospital directly and just had home-based services. And what they found, there was no long-term differences between these two groups in terms of quality of life, in terms of function, mobility, symptoms, pain, and just overall well-being. So this was a positive benefit saying about the feasibility and the safeness and appropriateness for going home after surgery. A second study looked at individuals who were discharged straight home from the hospital and then eventually had outpatient services, and then again compared this to individuals who were discharged to an inpatient facility. And they saw that individuals who were discharged straight home recovered just as well, if not better, than the group who went to an inpatient facility. And so what's important, and an important thing that was found in this group, is they also looked at individuals who live alone at home. And the same case is true, as those individuals recovered just as well, if not better, by being discharged straight home. And there's a lot of benefits. There's really no increased risks of complications or adverse events when being discharged home after surgery. And it actually has some emotional and psychological benefits of being in your home, being somewhere where you're comfortable, an environment where you feel comfortable and safe and can recover peacefully. So for the majority of cases, being discharged home from the hospital after knee replacement surgery is really the best option and really appropriate and safe and can have great outcomes. Now, of course, this isn't for everyone. You may be someone who has an increased risk of having adverse events, complications. You may be a little bit older. You may have a more complicated medical history. So be sure to discuss this with your doctor and your surgeons to have the most appropriate choice for you. But it really is safe. It really is possible. Now, some things to keep in mind is if you are going home after surgery and going home alone, is make sure you're planning ahead. So things to think about is the setup of your home. So what's the setup of your bathroom? Do you have a commode? Do you have a raised toilet seat or a grab bar or toilet frame to help you get on and off the toilet? Do you maybe need a bench or a chair in your shower initially so you feel safer taking a shower and bathing? Do you have the equipment you need, such as a walker or a cane, such as a reacher to help pick things up off the floor? Do you have support if there is some available, such as family or friends that live nearby or a friendly neighbor? And do you have a game plan? That's the main overall thing, the important thing. For example, meals. Are you going to have some pre-made meals? Are you going to order out? Have those things in mind. And of course, as you are discharged home from surgery, there is that option, and something that's very prevalent is home health services. So home health physical therapy, potentially a nurse who will come to provide some services, so that there is that option and that support as well. And usually that will continue until you're able to either get a ride or drive yourself to an outpatient facility to have outpatient physical therapy services. So going home alone after surgery is safe, it's appropriate, although not for everyone. For the majority of folks, it can be really beneficial and really effective. Thank you again for watching. Please be sure to click that subscribe button and turn on the notifications so you can catch all of our latest videos. Leave your comments and questions below and I'll be sure to get back to you. Thank you again.